In early January, a mumps outbreak at the privately run Pine Prairie U.S. Immigration and Customs Enforcement, ICE, processing center put Mejia and hundreds of other detainees on lockdown. When there is just one person who is sick, everybody pays, Mejia, 19, said in a phone interview from the Pine Prairie Center describing weeks without visits and access to the library and dining hall. His attorney was not allowed in, but his immigration court case continued anyway, over a video conference line. On February 12, the judge ordered Mejia deported back to Honduras. The number of people amassed in immigration detention under the Trump administration has reached record highs, raising concerns among migrant advocates about disease outbreaks and resulting quarantines that limit access to legal services. As of March 6, more than 50,000 migrants were in detention, according to ICE data. Mumps can easily spread through droplets of saliva in the air, especially in close quarters. While most people recover within a few weeks, complications include brain swelling, sterility and hearing loss. ICE health officials have been notified of 236 confirmed or probable cases of mumps among detainees in 51 facilities in the past 12 months, compared to no cases detected between January 2016 and February 2018. Last year, 423 detainees were determined to have influenza and 461 to have chicken pox. All three diseases are largely preventable by vaccine. 10 Democratic members of Congress sent a letter on February 28 to ICE Acting Director Ronald Vitiello seeking more information about viral diseases at immigration detention centers in Colorado, Arizona, and Texas. Lawmakers did not mention the Pine Prairie outbreak. Unprecedented numbers. The first cases at Pine Prairie were detected in January in 4 migrants who had been recently transferred from the Tallahatchie County Correctional Facility in Mississippi, according to internal emails. Tallahatchie, run by private detention company CoreCivic Inc., has had 5 confirmed cases of mumps and 18 cases of chicken pox since January, according to company spokeswoman Amanda Gilchrist. She said no one who was diagnosed was transferred out of the facility while the disease was active. We are seeing migrants arrive with illnesses and medical conditions in unprecedented numbers, McAleenan said at a press conference. However, vaccination rates in the countries of El Salvador, Guatemala, and Honduras are above 90%, according to the Centers for Disease Control and Prevention. ICE detainees come from countries all over the world, with varying degrees of vaccination coverage. High-profile removal at Pine Prairie. Staff members were at times at odds with the warden about how to manage the mumps outbreak, internal emails show. The warden decided not to quarantine 40 new arrivals from Tallahatchie in February despite concerns raised by the medical staff, one email showed. The warden, Indalecio Ramos, who referred questions about the outbreak to ICE and the GEO group, argued that quarantining the transfers would keep them from attending their court hearings, the facility's health service administrator wrote in a February 7 email. In a February 21 email, ICE requested that medical staff members at Pine Prairie clear a detainee quarantined for chicken pox and mumps for travel, calling him a high-profile removal scheduled for deport. In an email to staff later that day, Warden Ramos wrote that medical staff had wanted to exclude the detainee from transfer but ICE wants him to travel out of the country anyway. Please ensure he leaves. The ICE spokesman said that travel is restricted for people who are known to be contagious, but those exposed to diseases who are asymptomatic can travel. Since January, the 1094-bed Pine Prairie facility has had 18 detainees with confirmed or probable cases of mumps compared to no cases in 2018, according to ICE. As of mid-February, 288 people were under quarantine at Pine Prairie. Mejia said his quarantine ended on February 25. Detention centers in other states also have seen a rise in outbreaks. There have been 186 mumps cases in immigration detention facilities in Texas since October, the largest outbreak in centers there in recent years, said Laura Anton, the press officer for the Texas Department of State Health Services. In Colorado, at the Aurora Contract Detention Facility near Denver, run by the GEO Group. 357 people have been quarantined following 8 confirmed and 5 suspected cases of mumps detected since February, as well as 6 cases of chickenpox diagnosed since the beginning of January, said Dr. Bernadette Albanese from the Tri-County Health Department in Colorado. Civil rights attorney Danielle Jeffress said court hearings for quarantined immigrants at Aurora were largely canceled. At Pine Prairie on February 12, Mejia said he felt confused and hopeless during his video hearing, with no attorney by his side. After Mejia's lawyers complained, attorneys were allowed to visit quarantined detainees on February 13, one day too late for Mejia.